1. In the ICD-10-CM coding system, which of the following is the primary purpose of assigning diagnosis codes? A. To determine patient satisfaction levels. B. To standardize reporting of diseases and conditions. C. To establish a hospital's internal policies. D. To evaluate staff training effectiveness. 2. When mentoring a new coder on ICD-10-CM, which instructional strategy best aligns with adult learning principles? A. Requiring rote memorization of codes. B. Providing real-world patient case scenarios. C. Using only textbook definitions. D. Avoiding feedback to encourage independence. 3. Which ICD-10 code category is primarily used for external causes of morbidity? A. A00 to B99. E. F01 to F99. C. V00 Y99. D. Z00 to Z99. 4. In curriculum development for ICD-10 training, which of the following should be prioritized to meet regulatory compliance standards? A. Emphasizing test-taking strategies. B. Ensuring learners understand coding guidelines. C. Encouraging learners to guess unfamiliar codes. D. Reducing practice with real case studies. 5. An evaluator designing an ICD-10 test should ensure validity by A. Including questions unrelated to coding. B. Aligning questions with official ICD-10-CM guidelines. C. Making the test deliberately ambiguous. D. Relying only on student feedback. 6. When a coder encounters conflicting documentation, what is the best communication strategy according to ICD-10-CM guidelines? A. Code based on personal assumption. B. Assign the most common diagnosis code. C. Query the provider for clarification. D. Select the code that maximizes reimbursement. 7. Which ICD-10-CM chapter contains codes for mental, behavioral, and neurodevelopmental disorders? A. Chapter 5. B. Chapter 10. C. Chapter 13. D. Chapter 20. 8. In mentoring coders, which feedback technique is most effective for reinforcing accurate ICD-10 use? A. Providing detailed explanations for correct and incorrect choices. B. Focusing only on incorrect answers. C. Delaying feedback until the end of training. D. Ignoring mistakes to build confidence. 9. Which ICD-10-CM chapter covers diseases of the circulatory system? A. Chapter 4. B. Chapter 7. C. Chapter 9. D. Chapter 12. 10. In adult learning, self-directed practice is crucial. Which type of ICD-10 activity best supports this principle? A. Interactive coding simulations with feedback. B. Reading the ICD-10 manual silently. C. Memorizing chapter titles without context. D. Listening passively to long lectures. 11. The ICD-10-CM code Z000 is used for A. Encounter for routine child health examination. B. Encounter for general adult medical examination without abnormal findings. C. Encounter for symptoms, signs, and abnormal clinical findings. D. Encounter for pregnancy supervision. 12. Which of the following is a primary evaluation method for determining learner competency in ICD-10 coding? A. Multiple choice exams aligned with guidelines. B. Social activities promoting teamwork. C. Attendance logs for training sessions. D. Oral debates on healthcare policy. 13. A patient is diagnosed with type 2 diabetes mellitus with diabetic neuropathy. Which ICD-10 CM code is appropriate? A. E11.40. B. E11.9. C. E1065. D. E1121. 14. Which teaching method fosters deeper comprehension of ICD-10 among adult learners? A. Case-based learning with applied scenarios. B. Dictating long passages for transcription. C. Randomized code drills without context. D. Testing without providing rationale. 15. Which ICD-10 CM chapter contains codes for neoplasms? A. Chapter 2. B. Chapter 4. C. Chapter 8. D. Chapter 15. 16. When revising ICD-10 training curriculum, the educator should: A. Align content with updates from CMS and World Health. B. Keep outdated materials for consistency. C. Exclude changes to reduce learner confusion. D. Focus only on frequently used codes. 17. Which ICD-10 CM chapter includes conditions originating in the perinatal period? A. Chapter 11. B. Chapter 16. C. Chapter 18. D. Chapter 21. 18. A coder is unsure whether to code a symptom or a definitive diagnosis. According to ICD-10 CM guidelines, the correct approach is: A. Code both, regardless of documentation. B. Code only the definitive diagnosis if documented. C. Always code the symptom first. D. Assign the highest hanging code. 19. Which ICD-10 CM chapter covers injury, poisoning, and certain other consequences of external causes? A. Chapter 6. B. Chapter 12. C. Chapter 19. D. Chapter 21. 20. In training evaluation, which method provides the most objective measure of ICD-10 knowledge? A. Peer opinions. B. Coding case studies scored with rubrics. C. Informal group discussions. D. Open-ended reflection papers. 21. A patient is diagnosed with hypertension due to kidney disease, stage 3 chronic kidney disease. Which ICD-10 CM code applies? A. I12.0. B. I12.9. C. I10. D. N18.9. 22. Which ICD-10 capture includes codes for endocrine, nutritional, and metabolic diseases? A. Chapter 3. B. Chapter 4. C. Chapter 6. D. Chapter 14. 23. In adult learning, how can trainers improve retention of ICD-10 coding guidelines? A. Encourage learners to solve complex coding scenarios. Limit exposure to challenging cases. C. Require memorization without context. D. Avoid collaborative problem solving. 24. Which ICD-10 CM chapter covers diseases of the respiratory system? A. Chapter 5. B. Chapter 10. C. Chapter 14. D. Chapter 18. 25. When developing ICD-10 training materials, ensuring accessibility means: A. Using multiple formats such as text, visuals, and interactive cases. B. Offering only lengthy manuals. C. Limiting resources to digital platforms only. D. Providing content without real-world context. 26. Which ICD-10 CM code category is used for pregnancy, childbirth, and the puerperium? A. 0000-9A. B. P00 to P96. C. Q00 to Q99. D. R00 to R99. 27. Which ICD-10-CM chapter includes codes for congenital malformations, deformations, and chromosomal abnormalities? A. Chapter 14. B. Chapter 17. C. Chapter 19. D. Chapter 20. 28. To promote compliance, coders must stay updated with annual ICD-10-CM and ICD-10-PCS revisions. B. Outdated training manuals. C. Non-coding clinical notes. D. Only state-specific guidelines. 29. Which ICD-10-CM chapter covers symptoms, signs, and abnormal clinical and laboratory findings? A. Chapter 18. B. Chapter 20. C. Chapter 21. D. Chapter 3. 30. During mentoring, which approach best promotes independent problem-solving in ICD-10 coding? A. Guiding learners through reflective questioning. B. Providing all answers immediately. C. Allowing learners no input. D. Discouraging questions during training. 31. Which ICD-10-CM chapter includes codes for diseases of the musculoskeletal system and connective tissue? A. Chapter 7. B. Chapter 13. C. Chapter 15. D. Chapter 19. 32. A patient presents with chest pain, but no definitive cardiac diagnosis is established. Which ICD-10-CM code should be used? A. I 20.9. B. R 07.9. C. I 25.10. D. Z 13.6. 33. In assessing ICD-10 coding competency, formative evaluation is best described as A. Ongoing feedback to guide improvement. B. A one-time certification exam. C. Post-training peer celebration. D. Instructor self-reflection only.